Stragglus is another term for the talus bone. The talus is the most superior of the tarsal bones. It transmits the weight of the entire body to the foot. It also helps in transmission of the forces from the tibia to the heel bone. As I've told you earlier, the proximal row of the tarsal bones consists of the talus and the calcaneus. Let's discuss talus first. The talus bone possesses a head, a neck, and a body. It forms three joints with the surrounding bones. Superiorly, it articulates with the tibia and fibula, forming the ankle joint. Inferiorly, it articulates with the calcaneus, forming the subtalar joint, and anteriorly, it articulates with the navicular and forms the talonavicular joint. The talus bone is wider anteriorly as compared to posteriorly, providing additional stability to the ankle joint. The head of the talus is directed distally and has an oval convex articular surface for the articulation with the navicular bone. The neck of the talus lies posterior to the head and is slightly narrowed. Its upper surface is roughened and gives attachment to the ligaments. The lower surface has a deeper groove, the sulcus tali. The body of the talus is cuboidal. Its superior surface articulates with the distal end of the tibia. Its lateral surface presents a triangular articular facet for articulation with the lateral malleolus of fibula, and the medial surface has a small comma-shaped articular facet for articulation with the medial malleolus of tibia. The calcaneus is also referred to as heel bone, which is one of the largest bones of the foot, and it forms the prominence of the heel. The weight of the body passes through the tibia into the talus and then to the calcaneus. While walking, as the heel hits the ground, it takes all the weight of the body. The other bone in the proximal row is the calcaneus, so let's discuss it in detail. The calcaneus articulates above with the talus to form the subtalar joint, and in front with the cuboid, forming the calcaneo-cuboidal joint. Let's discuss the surfaces in detail. It has 6 surfaces, and we will be discussing important landmarks of these individual surfaces in detail. The anterior surface is small and forms the articular facet for the attachment with the cuboid bone. If you look at the anterior aspect, we can see a bony prominence called the sustentaculum tali. It supports the medial aspect of the talus bone. The posterior surface forms the prominence of heel and has 3 facets: the superior facet, the middle facet, and the inferior facet. The retrocalcaneal bursa is present on the superior facet, whereas the middle facet provides attachment to the Achilles tendon. The inferior facet unfortunately don't have any attachment sites. The superior surface is dominated by 2 articular facets for the talus, which are separated by a roughened groove, the sulcus calcanei and the sustentaculum tali. Then comes the inferior surface. It has an anterior tubercle in the midline and a large medial and a smaller lateral tubercle at the junction of inferior and posterior surfaces. The medial surface possesses a large shelf-like processes termed as sustentaculum tali. Last one is the lateral surface, which is almost flat. On its interior part is a small elevation called the peroneal tubercle, which separates the tendon of peroneus longus and brevis muscles. It has a calcaneal tuberosity and facet for cuboid. So let me tell you an interesting fracture of the calcaneus bone. The fracture of calcaneus is known as the lover's fracture. Wondering why it is called lover's fracture? The story behind the name is, it is derived from the fact that a lover jumps from a greater height to escape from the lover's spouse, ultimately damaging the calcaneus bone.